understanding first aid and its golden rules. Let us now understand what first aid means and why it is crucial in your daily duties. First aid is the immediate care given to an injured or suddenly ill person before full medical treatment is available. In the Indian railway setting, this could mean helping a colleague who has fallen from a ladder in a signal yard, or attending to a passenger who has slipped on a wet station floor. The golden rules of first aid are simple yet powerful. First, do not panic. Stay calm and think clearly. Second, protect yourself and the victim from further harm. Third, assess the situation quickly. Check for consciousness, breathing, bleeding, or fractures. Fourth, always send for medical help immediately. And finally, comfort and reassure the victim throughout the situation. These steps provide a structured way to handle any emergency with confidence. Basics of human anatomy and vital signs. To provide proper first aid, it helps to understand the basics of the human body and how to check vital signs. The human body depends on the proper functioning of three main systems: the respiratory system, the circulatory system, and the nervous system. Together, they control breathing, blood flow, and brain activity. When a person is unconscious, your first step is to check for signs of life. Speak to them, gently tap their shoulder, and see if they respond. If there is no response, observe the chest to see if it's rising, or place your ear near the mouth and nose to detect breathing. Check the pulse on the wrist or neck. If breathing is present but the person is unconscious, place them in the recovery position on their side to keep their airway open. In case of no breathing, be prepared to begin CPR if trained. Imagine a linesman getting electrocuted while working on overhead equipment. Your quick check of their vital signs can determine whether CPR is needed and can guide your next steps. Common railway scenarios and first aid responses. Now, let's look at real-world situations in Indian Railways and the first aid measures suitable for each. Bleeding is one of the most common emergencies, especially in accidents at level crossings, during loading and unloading, or slips on moving trains. To control bleeding, apply firm pressure with a clean cloth and elevate the injured limb if there's no fracture. Burns are also frequent, whether from hot water spills in pantry cars or accidental contact with electrical tools. For minor burns, cool the area with running water, avoid applying creams or ice, and cover it with a sterile cloth. For fractures or sprains, often occurring during heavy lifting or slips, do not move the limb. Immobilize the area using splints or wooden boards and secure with cloth. For heat exhaustion or fainting, especially during summers, move the person to a shaded spot, loosen clothing, and offer water if conscious. For seizures, turn the person on their side, ensure the surroundings are safe, and avoid restraining them. In all cases, medical help must be summoned immediately while you offer reassurance.